Good morning. Welcome to ePathshala. Under the subject Social Medicine and Community Health, we have been giving a series of talks on healthcare delivery system, and now we are going to discuss the health assistant male and female who are normally posted at the primary health center. Thanks to the development team under the leadership of Professor C.P. Mishra of Institute of Medical Sciences, Banaras University. Coming to the learning objectives, we have job responsibilities of the health assistant male and health assistant female, and health assistant in guidance, supervision and teamwork, role of the health assistant male in the different diseases, and role of the health assistant male in maintenance of records, supplies and maintenance, role of health assistants in the UIP and sanitation, and role of the yes, of course he has a role definitely in a universal immunization program, but in this he has to work hand in hand with his counterpart, that is the female. And the role of the multipurpose worker in vital events and record keeping. Then coming to the role of the health assistant female in NCH, family planning, MTP, universal immunization program, nutrition, and most important in training of guys and of the field level personnel, and role in primary care. In the introduction, based on the guidelines, we have to base whatever services are coming through, whatever training we have to give, it is based on the guidelines of the Indian Public Health Standards. Under the multipurpose workers scheme, a health assistant is expected to cover a population of 30,000, that is 20,000 in the tribal and the hilly areas, in which there are 6 sub-centers, each with a health worker male. Now these are some nice pictures which are showing Indian Public Health Standards, guidelines for the sub-centers, and we have these workers who are responsible for maintaining the health care at the peripheral level. Now, what are the duties of the health assistant male? I have just been talking to you about the fact that supervision and guidance is one big important role, and along with this, he carries out the supervisory home visits once a week and making his duties of all the sub-centers. So, supervisory home visits wherever needed, he will definitely make. But his is mostly as a part of the teamwork, and he helps the health workers to work as a part of the health team. He coordinates the health activities. He conducts staff meetings fortnightly at one of the sub-centers by rotation. If there are 4 sub-centers, then once a week every sub-center will be covered. He attends the staff meetings at the primary health center, and he also assists the medical officer in conducting training programs for various categories of the health personnel. Because you see, training and care and maintaining documents is a very important part of his duties. Now, in supplies, equipment, maintenance of the sub-centers, this is a very important role because he is in charge of seeing that they are maintaining the slides, the medicines which have to be given. So, therefore, he has to check the store's availability, ensure the timely placement of indent for and procure the supplies and equipment in good time. He has to check that the drugs are maintained, properly stored, and the equipment is well maintained. He also has to ensure that the health worker male maintains his general kit absolutely properly, and for the records and reports, he must scrutinize the maintenance of records by his junior, that is a health worker male, and guides her or him in their proper maintenance. He must review records received from the health worker male and consolidates them and submits also the reports to the higher authorities. Duties, as far as we have all the time been emphasizing that national eradication, national control programs, national eradication programs are going on consecutively through the primary health centers and to the sub-centers to the peripheral areas. So he is a part and parcel of this drive. And for malaria, filaria, whatever, collection of records, collection of smears, everything has to be done. For example, in malaria, he has to supervise the work during the concurrent visits. He must check minimum of 100 houses in a village. He carries a kit for collection of blood smears, which he immediately takes and records it, and he must transmit for examination. He collects thick and thin smears from any fever he comes across. Most important, as soon as he takes the smear, he must administer presumptive treatment of anti-malarial drugs then and there. Then he plans, executes, and supervises the administration of the radical treatment, and he supervises the spraying the insecticides. In other words, if he comes across a case, a suspected case, he must take the smear, he must give presumptive treatment, he must start on the anti-spraying activity, and all this is with a view to stop spread from one person to another person before this particular case spreads and becomes an epidemic. So that is most important. So local containment of these cases, local containment of this disease or the fever must be done. Now, similarly, in the Kala Azar endemic areas, he checks a minimum of 10% of the houses in a village. He identifies actually suspected cases of Kala Azar and ensures complete treatment. He carries proper record forms, diary, guidelines for identifying the suspected Kala Azar cases and ensures complete coverage. Treatment of Kala Azar patients, spray activities and search operations are a part of and parcel of his duties. And of course, he must undertake health education activities for any of patients whom he has missed. So there is an unwritten listing that if they start having fever or pain in abdomen, they must report to the sub-center or to the primary health center at the earliest, or to this male health assistant, male worker or the assistant, so that he may be checked and put into the register. And along with it, of course, he must undertake health education activities. But in places where there are Japanese encephalitis endemic areas, this becomes additional duties, because he has to maintain a minimum of 10% of the houses in a village. He identifies suspected encephalitis cases and ensures motivation of community which has been done properly. He carries proper environmental check, gets it to clean the environment, carries, for example, in Japanese encephalitis areas mostly occur in the rice growing areas. So this regular flooding of the rice fields is one of the typical hazards of Japanese encephalitis spread. So he carries proper record forms, diaries, guidelines, and he must inform if a suspected case comes into his purview, because before it can spread from fever to encephalitis, he must take care to contain it properly. In the communicable diseases, he identifies the sudden outbreak of epidemics of diseases such and takes all possible remedial measures. He takes the necessary control measures when any noticeable disease is reported to him. He carries out the destruction of stray dogs with the help of the health worker males. Along with communicable diseases, you see, health education is a part and parcel of his. And it is most important that if he is going to look after malaria or filaria or Japanese encephalitis, he must educate the public, he must educate his other workers, to be able to identify, to be able to take note of, to be able to take for treatment, and to contain the disease well in time. Leprosy is one of the important programs for which Mahatma Gandhi gave us the impetus to look after these cases. I have time and again I have mentioned that leprosy was a disease which had a stigma to it. Leprosy means out of the village, out of sight, out of the house. But today that is not the position. Leprosy is a disease which has been controlled, which can be treated, and these people, if taken well in hand, they can become active members of the community. So, in cases suspected of leprosy, he takes the skin smears and he sends them for examination. In case it turns out to be AFB positive, then these cases are put into the register and a complete treatment is started for them in terms of the dapsone or whatever the drugs which are drug regimen which is being followed, and he informs the medical officer of the primary health center about any defaulters. Now that is important because defaulting means you are going to improve resistance. And once resistance comes, then these people are likely to shift from the primary cases to the secondary. Resistant treatment will have to be given, which becomes a difficult situation. Tuberculosis is a better marker, but the most important thing is that each and every house has to be checked for the tuberculosis cases. We have to check whether all the cases of tuberculosis are taking regular treatment. We have to motivate the defaulters. We have to bring them to the notice of the medical officer, primary health center, and we have to ensure that all cases of tuberculosis take regular and complete treatment and informs the medical officer about it. Now, in this tuberculosis, most important, if a case is caught at the right time by the house-to-house visits, and if he is complaining of fever, a sputum examination for AFB negativity or positivity is an absolute must. Once he becomes, he is categorized into either AFB positive or negative. Accordingly, his treatment will start from group A or group B, and this will have to be continued for the 6 months or the 8 months as per the national schedule. And they have to, for every case detected, they have to inform the medical officer of the primary health center so that any defaulters to this treatment schedule will be noted and will be brought back. Environmental sanitation is an important community aspect for health, and they have to help in the community sanitation, which will include safe water sources, soakage pits, kitchen gardens, manure pits, compost pits, sanitary latrines, smokeless chullas, supervise their construction. And of course, most important, supervise the chlorination of the water sources of the wells. Now, a word about environmental sanitation. See, when we talk about all this, environmental sanitation is keeping the environment clean on all accounts, on all sources. So it is the safe water right from the source to the consumption point. Any extra water which is being thrown, people must learn not to waste it, but instead direct it towards the soakage pits. These will be pits which will be dug near and about the kitchen. So any waste water which goes into these pits, filters through the water, filters through the stones and the construction of the soakage pit, and the water comes out so that in fact it may be used in the gardening, in the kitchen garden. So you don't waste a single drop of water. Manure pits are there, so whatever material comes out from the kitchens, so they can be put into the manure pits, and at the end of the day, at the end of 3 months, you are actually getting good manure, organic manure, which you can use in the kitchen gardens, compost pits, then sanitary latrines. The government has been helping construction of the sanitary latrines, and it is only subsidized cost that these people have to make them. So there is safety to health, safety to cleanliness, and less of infection of worm infestations. Then, most important, we have been battling with the fact that trachoma and eye infections were common in our country because they actually in the kitchen constructions in the rural areas there is no kitchen separately. Maybe it is a one-room tenement house in which a corner is used as a kitchen and the smoke, since we are using wood, so there is bound to be smoke. If it is overcrowded, there is bound to be overcrowding and infection. So, in order to reduce this, the incidence of acute respiratory infections in overcrowded conditions, in smokeless kitchens, the fact that a smokeless chulha can be constructed at no cost, literally no cost, so that the smoke goes up and is out of the house and the atmosphere remains clean. And supervised that way, the incidence of trachoma has also come down and incidence of infection has also come down. Because previously we were saying women who were constantly in the kitchen, in the smoking kitchen, were constantly affected with eye problems. They supervise the chlorination of the water because this is absolutely important. And for the chlorination of the water, it is important to know as per the weather differences, the frequency of chlorination will have to be changed. Then universal immunization program, we have to conduct immunization of all school-going children with the help of the health worker female and supervise the chlorination of the water sources including the wells. Family planning is an important program and an institution by itself. Now it is a part and parcel of duty of every health assistant, male or a female, to take part in the family planning program. So in which they have to personally motivate the resistant cases, they have to guide in establishing female depot holders, they have to assist the medical officer of the primary health center to organize camps and drives and provide information on availability of services for medical termination of pregnancy or refer the suitable cases to the approved institutions. Most important, ensure follow-up of all the cases of vasectomy, tubectomy, IUD and other family planning acceptors. I have also mentioned in previous lectures that if a vasectomy has to be done or a tubectomy has to be done or an IUD insertion, special care and special advice has to be given to these people. Never forget to tell the person undergoing vasectomy that he must take precautionary measures as the use of condoms for at least 3 weeks after the vasectomy is done, 3 to 6 weeks after the vasectomy is done, because it is possible that sperms may be still alive in the vas deferens even after the vasectomy is done. So therefore, to prevent any such cases of accidental pregnancies after vasectomy, due care must be taken. Similarly, tubectomy should be done at a time when we are completely sure that the woman is a non-pregnant. That is, after she has had a period, that is the best time to do a tubectomy. Insertion of IUD, we have to be very careful that we are sure, because IUCD should be inserted only after the period after the menstruation has occurred, because that signifies that we are inserting IUD into a non-pregnant. So due care has to be taken at every step. They have to supervise and guide in the delivery of healthcare service to the community, strengthens the knowledge and the skills, visit each health worker female and guide her in the day-to-day activities. Means now we are talking about a health assistant female. Then she assesses the progress of the work and submits the report. She carries out supervisory home visits at least once a week and She must be a part and parcel of the teamwork, and she has to help her coordinates and the health workers coordinate the health activities, conduct the staff meetings. So, for any activity which is taking place at the primary health center or even at the community health center, they must be moving back and forth in order to attend and be a part of every single health educational activity. So we assist the health medical officer in conducting the training programs also. Supplies, equipment, maintenance of the sub-centers is important. Once again, they have to be very careful that at the sub-centers, the drugs which are available have been got at the right time from the primary health centers. And they have to check that the drugs are properly stored and the equipment is well maintained. Ensure that the health worker females, now there is a problem of rats, so some of the drugs are being chewed upon them. So insects, small animals should be well out of the reach of children and animals. Then ensure that the health worker female also maintains a general kit in a proper way. She cleans it regularly and ensures that her kit is well supplied and well equipped. Ensure that the sub-center is kept clean and it is properly maintained. Records and reports, they must scrutinize all the supervisors, they must scrutinize the records of the health worker males and the females and consolidate them and send the reports ahead. Now she also, just like the health assistant male, she also has the work of collecting minimum checking 100 houses, and she also does a kit for collection of blood smears. She must give the presumptive treatment for anti-malarial drugs, and she must inform her superior for administration of the radical treatment. Once the smear becomes positive, it must be followed by the administration of the radical treatment, and she must supervise the spraying of insecticides during the local spray time. Same thing in Kala-Azar, along with the component of health assistant male, she must take part in the Kala-Azar endemic areas, visit the houses, identify the suspected cases, give the proper records, diary the records, maintain the cases, and ensure complete coverage of the Kala-Azar treatment and assist in the search operation. Additional duties again in the Japanese encephalitis area, just like her counterpart male. She checks minimum of 10% of the houses in a village, identifies suspected encephalitis cases, ensures motivation of community has been done properly. Most important, they must be caught in time, treated in time, and the area looked after well in order to prevent the transmission of Japanese encephalitis cases. Health assistant male. Some of his duties are also for organizing. Now, I would say that it is both the health assistant male as well as the female who are training and organizing and conducting training for guys and ASHA with the assistance of the health worker female. So, both of them are actually working hand in hand. And you can see in the picture also that both of them are working and training the ASHAs together. Assist the medical officer of the primary health center in conducting training programs for various categories of health personnel. And we see a nice, happy picture of a mother and a child. And in the maternal and child health services, the weekly clinics have to be done at the sub-center and with the help of the health worker female and the guys. So at the sub-center, it is the health worker female, and she must work hand in hand with her supervisor from the primary health center. She responds to the calls from the health worker female, health worker male, and health guides, trained guides, and renders the necessary help. She also must conduct the deliveries when required at the primary health center level, and she provides domiciliary and midwifery services. If necessary, the male health worker also helps. Now, some of the other duties of the health assistant female, apart from the supervisory, are of course in family planning and MPP. She maintains up to date eligible couple registers at all times. She conducts the weekly clinics along with the MCH clinics, personally motivates resistant cases for family planning, and she provides information on the availability of services of MPP and sterilization to end up with a happy and a controlled family. And of course, the health assistant female again duties extend to the female depot holders for distribution. So means the female depot holders must have, and it is this health assistant female through the health assistant worker who gives to the depot holders in the village for distribution of conventional contraceptives, and she trains them also how to give, when to give, what is the meaning of these medicines which are being given. She provides, of course, she has to provide the IUCD services. The IUCD services cannot be given by a community health worker at the field level chosen from the village. And the assistant, the female assistant, must help the MO of the primary health center in organization of family planning camps, drive. She provides the IUD services and their follow-up. Then, because immediately after the insertion of the IUCD, it is possible that the patient may complain of fever or may complain of local abdominal pain, and she might ask that it must be removed immediately. She might get worried. So, this tempering of her mental status, tempering her acceptance of the IUCD, and telling her to wait for some time till it subsides and becomes normal is a part and parcel of the education given by the health assistant female. So of course, she has to assist the MO. Then in nutrition, at the same time, while talking about all these practical aspects of family planning, reproductive health care, and malaria containment, filaria containment, nutrition is a part and parcel of every single subject. She has to ensure that all cases, now we were talking of school health. So, nutrition comes under school health, antenatal women, family planning women. So, all cases of malnutrition amongst infants and young children 0 to 5 years, necessary treatment, advice, and if necessary, maybe even given recipes so that they improve their cooking skills and give the proper foods. I'm sorry to say we are giving a nice picture of strawberries and Brussels sprouts and things which are probably not available in our country. So please don't be led away with all this. But yes, whatever foods are available in our village circumstances as per the area, there is coconut in the south, there is kela is present everywhere throughout the country. आपको अनार मिलेगा, अंगूर मिलेगा, अमरूद मिलेगा, then dal milega, eggs are available everywhere. So a proper mix and match of nutrition must be given. Along with that, iron and folic acid, vitamin A distribution are a must, and of course educate the expectant mother regarding breastfeeding, which is a very important component. To continue with the health assistant female duties, let us not forget the universal immunization program, because that, along with MCH, is a part and parcel of her duty. She has to organize, she has to give the immunization, she has to motivate each and every family member to accept it, and most important, see to the supply chain, the cold chain supply, the storage of vaccine, health education, and the small miniature camps which are being placed in field to field, collect women and give immunization. That is important. Supervise the immunization of the pregnant women, most important, with tetanus toxoid, and in other, for example, acute respiratory illness. Now, ARI infections are very predominant, particularly in the villages and in the overcrowded areas. And this comes up as and when the weather changes, the cold weather starts, the acute respiratory illness it spreads rapidly amongst the under 5s, amongst the young children, and from amongst the mothers, particularly who are attending small miniature camps. So, this spread, containment, diagnosis of acute respiratory illness is an absolute must. And once diagnosed, these cases must be referred from the periphery to the subcenter, to the primary health center, or if necessary, in cases where oxygen is needed, to the community health center also, so that no child dies of acute respiratory infection or its morbidity increases the ill health of the person. So, early referral in doubtful and severe cases is the key word. School health, they must of course help the medical officers who are coming in from the centers, and the school health services we have already talked about. So all these basically are actually talking about primary health care. So the health assistant, female or the male, are giving in their work schedules the basic primary or the essential medical care at the grassroots level, which includes treatment for minor ailments and provision of ORS and first aid for accidents, emergencies, refer the cases. Means a person, if he falls ill at the grassroots level, he need not have to rush or spend money. These should be available at his house or at the nearest hospital or at the nearest center itself. And along with all this, health education activities are a part and parcel of their duties. In other words, information, education, communication is an ongoing process for every single subject of health, and they can be organized through Mahila Mandals, teachers and other women in the community, through welfare programs, or on any national holiday. August 15th आया, अगर फेयर लगता है उसमें पढ़ाइए, दिवाली दशहरा में मिलते हैं तो पढ़ाइए. So use every opportunity to help educate. So the summary means the health assistant male provides supervision, guidance to health worker male, helps and coordinates the teamwork, maintains supplies, equipment, maintains record, and the health assistant female, in addition to all the above which the male does, she also carries out the responsibilities of provision of unsafe services, nutrition, health education, school health, etc. So with this, I thank you for visiting ePathshala. Thank you.